Hello dear candidates, so today we'll study the structure of the headache scenarios. So it is one of the important topic for the PLAB 2. So we will quickly review them all. First of all, you have to do introduction, patient introduction, doctor introduction, then comes the Socrates part, which is important. We'll just quickly review them, that where exactly the pain is, when did it start, what does it feel like. Always give patient the options, right? So for like is it dull type, throbbing pain, or sharp pain? Then ask for that, does the pain spread anywhere else in the body? Also ask for that is there anything that makes the pain better or worse? As I mentioned, always give options to the patient, like movement, position, or being outside. Right. Then ask for that, on the scale of 0 to 10, how does it feel, how bad is this, right? Then important part is the differential diagnosis. This give you the clue as well. These are the red flags as well. You rule out all the differentials, and then you narrow your diagnosis, right? So if it is possible, all do mention all these questions for the headache, right? So simple for the migraine, you just ask that you get nausea or sensitivity light or any vision symptoms before the headache. For the menstrual migraine, ask like, do these headaches come around your periods, right? Then for the GCA, you have to ask like, is there any scalp tenderness, any jaw pain while chewing, or any visual changes? For hangover headache, you have to ask that, did this come on after drinking alcohol, right? Then for the tension type headache, you have to ask that, does this feel like a tight band or pressure, right? Or you can also ask that, does that come after stress or long work days? For sinusitis, you can ask that, is there any facial pressures or nasal discharge, or runny nose, blocked nose, nasal congestion? For the idiopathic intracranial hypertension, you can ask like, does bending forward or coughing makes this pain worse or not? For the medication, you overuse headache, you have to ask like, have you been using the painkillers more than two to three times a week, right? Then for the subarachnoid hemorrhage, you can ask like, does this headache come on very suddenly, or is it the worst headache? For the meningitis, you have to ask like, is there any fever, any neck stiffness, any visual changes, or of flashing lights, right? For the carbon monoxide poisoning, you can ask like, does the headache is the headache becomes better when you are outdoors, or or anyone in the home, they are unwell, or they are also feeling the same, right? Then comes the pneumatosa, at any previous diagnosis, any previous medical conditions, if she's taking any medications, any allergy to medications, family history, anyone else in the home feeling the same, right? Any travel history. Travel history is important for the meningitis as well, right? Then you can ask for their social life. Who do they live with? Anyone else in the home? Or how's their do they smoke? Do they consume alcohol? Or are you under any stress? Eyes very important, right? So for the eyes, you can ask, what do you think these symptoms may be due to? Is there anything concerning you, or concern you are particularly worried about? Expectations, that what were you hoping I could help you today? Effect on life, for all the headache scenarios, do ask the effect on life, that is this affecting your day-to-day activities, your sleep, your study, your work, right? For headache examination, after mentioning the vitals, also mention the neurological examination. Beside neurological examination, do mention that I would like to check the back of the eye, I would like to examine the eye as well, I would like to check the scalp, right? Then also you can say that I would like to check the body for any rashes, right? Then diagnosis, just simply tell the diagnosis, right? We will also quickly review the diagnosis and management of all these scenarios in next videos, right? Then safety netting, you can tell any of the symptoms from them. See, for it's very easy if you pick any if you tell the symptoms of the differentials in the safety netting, that you have to seek medical help whenever you are having such symptoms. Then comes the follow-up and leaflet, right? Thank you, keep following me, I'll be uploading next videos as well, right? Thank you.